Hello and welcome back to a new video. So here we will talk about the Risperidone. Risperidone is an antipsychotic medication that is used in treatment of schizophrenia, and in this video we will explain the pharmacology of this medication. You can always skip to other parts of this video using the video chapters available in the video description. So let's start with an overview of the Risperidone. So Risperidone is the scientific name of this medication, and the famous trade name for it is the Risperidone. And it is classified as atypical antipsychotic medication. So antipsychotics are classified into typicals and atypicals. Typicals are the old antipsychotics. They are discovered in the 1950s. And the atypicals are the new antipsychotics that are discovered in the 1970s. And they are also called the second generation or the new antipsychotics. And Risperidone is from the atypicals. And it is used in treatment of schizophrenia and some other mental disorders, and it is better tolerated than typical antipsychotics because of fewer side effects that comes with this medication in comparison with the typical antipsychotics. And Risperidone was synthesized in the 1980 in Belgium. Now let's talk about the pharmacokinetics of the Risperidone. So Risperidone is available as oral, intramuscular, and intravenous formulas, and there is a long-acting injectables formulas with a duration of action of 2 to 4 weeks. Long-acting formulas provide improved compliance and reduced relapse rates compared to the oral formulas. And the oral formula of the Risperidone has good absorption with bioavailability of 70%, and it is metabolized by the liver by the cytochrome P450 enzymes, especially the CYP2D6, and it is excreted mainly through urine, and it is also excreted through feces. Now let's talk about the mechanism of action of the Risperidone. So Risperidone antagonizes the serotonin 5-HT receptors and the dopamine D2 receptors also. But it has more serotonin antagonism than dopamine antagonism, and that's what makes it different from the typical antipsychotics. Because the typical antipsychotics antagonize dopamine better than they antagonize serotonin, while the atypicals antagonize serotonin better than they antagonize dopamine. And serotonin antagonism makes Risperidone good in managing the negative symptoms of schizophrenia, like social isolation, poverty of speech, lack of motivation, and inability to feel pleasure. So serotonin antagonism that comes more with the atypicals make them good in managing the negative symptoms, while the typicals, which are the old psychotics, they are worse in managing the negative symptoms of schizophrenia. So that is another difference. Antagonism of serotonin by this medication also lead to relief of some of the extrapyramidal side effects that occur as a result of the dopamine antagonism. So those are all benefits of serotonin antagonism, but serotonin antagonism lead to negatives too, like weight gain, metabolic changes as adverse effects with the use of this medication. So we mentioned that the Risperidone antagonizes serotonin and dopamine, and we talked about on how it antagonizes the serotonin. Now let's talk about on how it antagonizes the dopamine. So Risperidone works by antagonizing dopamine also, and it blocks the dopamine in the mesolimbic and the mesocortical pathways, which lead to the relieving of the psychosis. And by psychosis, I mean the positive symptoms of schizophrenia, like hallucinations and delusions. And risperidone also work to relieve these symptoms. So the mesolimbic and the mesocortical pathway connects the ventral tegmental area with the nucleus accumbens, that is for the mesolimbic pathway, and the mesocortical connect the ventral tegmental area with the frontal lobe. So those two pathways, when dopamine blocked in them, this would lead to the relief of the psychotic symptoms. Now, risperidone also blocks dopamine in the nigrostriatal pathway. Nigrostriatal pathway connects the substantia nigra with the striatum and the caudate here through this. And when dopamine is blocked in this pathway, this would lead to the extrapyramidal symptoms as adverse effects. Those include muscle rigidity, dystonia, akathisia, and dyskinesia. Now, risperidone also blocks dopamine in the tuberoinfundibular pathway, which connects the hypothalamus with the pituitary gland. This pathway is responsible for balancing the prolactin levels, and when this pathway dopamine is blocked, this would lead to hyperprolactinemia as an adverse effect to the risperidone. And it has antihistamine activity, which lead to drowsiness, and it blocks alpha adrenergic receptors to some degree, which lead to postural hypotension and lightheadedness. Now let's talk about the therapeutic uses of the risperidone, and let's start with the FDA approved therapeutic uses. The first one being schizophrenia, which is in adults and children aged 13 and older. The risperidone is more effective in treating schizophrenia than all typical antipsychotics except for the haloperidol. So risperidone is more effective than typicals except for the haloperidol, and it is less effective than some of the atypicals like the clozapine and the olanzapine in treatment of schizophrenia. And it is also used for acute manic or mixed episodes of bipolar disorder as a monotherapy for adults and children aged 10 and more. And it is also used for acute manic or mixed episodes of bipolar disorder as a ditherapy with dilithium or valproate. And it is also used for autism in children aged 5 and older. So risperidone controls the problematic behaviors, the aggression, the self-injury, and rapid mood changes in autistic children. And there is non-FDA approved therapeutic uses like dementia. So risperidone produces slight benefits in dementia patients, but there is increase in the risk of death because it increases the risk of stroke in these people. And it is also used for treatment of psychotic polydipsia and for PTSD, delirium, depression, borderline personality disorder, conduct disorder, and Tourette disorder. Now let's talk about the dosing of this medication. So for schizophrenia, start with 1 milligram daily, then increase the dose by 0.5 milligrams every 6 to 7 days to target 2 milligrams daily. Doses exceeding 4 milligrams per day are rarely more effective, and max dose is 60 milligrams per day. And for elderly, the same dose except you increase by 0.25 milligrams every 6 to 7 days instead of 0.5 milligrams. And for acute manic episodes of bipolar disorder, you use 2 to 3 milligrams daily dose, and the max dose is 6 milligrams per day of risperidone. And the daily dose in both disorders can be taken at once or divided into 2 doses per day. Now let's talk about the adverse effects of the risperidone. So it leads to weight gain, high blood sugar levels, and metabolic problems because of the serotonin antagonism. It also leads to sedation because of the histamine blocking and the serotonin blocking, and it leads to hyperprolactinemia because it inhibits the dopamine in the tuberoinfundibular pathway, which lead to sexual dysfunction. And there is increased risk of seizures in seizure disorder patients. And it also leads to extrapyramidal symptoms, which are movement disorder, because it inhibits the dopamine in the nigrostriatal pathway. And risperidone produce more extrapyramidal symptoms than other atypical antipsychotic medications. The extrapyramidal symptoms include acute dystonia, which is muscle spasm, develops within hours to days after initiation of treatment. Akathisia, which is restlessness, that develops days to months after initiation of treatment. And tardive dyskinesia, which is uncontrollable repetitive movements, develops after years of initiation of treatment. And finally, muscle rigidity. And risperidone may lead also to neuroleptic malignant syndrome. This is a severe type of extrapyramidal reaction, and it's a triad of muscle rigidity, hyperthermia, and autonomic disturbance. Finally, let's talk about the contraindications. So risperidone is contraindicated if there is a previous hypersensitivity reaction to the risperidone or to its metabolites like the paliperidone. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like this video and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this video. Thank you guys for watching, and peace.